Today we'll be demonstrating a passive shoulder range of motion exercise. One of the common things to happen with a lot of shoulder conditions is we can lose range of motion. And so one of the first things we have to do when we're solving shoulder pain is get that range of motion back, because we can't start adding in a lot of the strength exercises that we would want to do if we can only get our arm up to here. And so this passive shoulder range of motion exercise is going to be a great way to start to restore that range of motion. So to perform, all you need is something long and skinny. So you can use a broom. I use a little PVC pipe here. And let's say it's my left shoulder is the one that I'm having issues with. So if that's the case, I'm going to put the head of the broom just in my palm here. And the goal is to relax this arm as much as you can. Again, we don't want the muscles of the shoulder to do any of this movement. And so we're going to start out to the side. And you're just going to, here, I'll scoot back so you can see. You're going to press up and out to the side. Again, just going as high as you can, stopping the minute that you feel pain. And then back down. And what you should start to notice is, again, it might take a couple rounds or a couple days or sometimes even weeks, is that the more you do this, the more you'll slowly start to get that range of motion back. It's important to be just patient with it. And so what I like to do is I always start out to the side and then just kind of work our way inside like that. So what it looks like, you start out to the side, go as high as you can, move the arms slightly forward. Slightly forward. Again, just going as high as you can. You might be able to go a little bit more as you start to move forward until you get to this flexion standpoint where the arm straight up there. And the last range of motion is this external rotation, which is a little bit different. So with this one, just tuck your elbow nice and close to the body, and you're just going to use the PVC pipe to really turn your arm out, again, stopping when there's pain. Good. So the only thing to keep in mind with this exercise is the difference between shoulder pain and a shoulder feeling stuck. So when we're doing this, anytime we feel pain is the minute we want to stop. We want to stop before that. But in some shoulder conditions, it just gets stuck. It's not necessarily painful, but you just get to here and I can't go any higher. And in that case, what we really want to do is push the end range just a little bit. We're not going to go so far that it like tears anything. But if you get to this point, it's not painful. It just won't go any higher. Add a little bit of overpressure just for a second to try to get that extra range of motion and then back down. Again, what we're trying to do is stretch that joint capsule to get that range of motion. And as long as it's not painful, if it's just like kind of like a stretching feeling, that's 100% okay. So there you have it. If you have any questions, go ahead and leave them in the comments down below. My name is Dr. Carl Baird. I want to thank you so much for being here, and we'll talk to you soon. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.